AB New York focused on LGBTQ plus communities and public health, and we looked at their healthcare disparities and went to a couple different organizations in order to fully examine this issue. New York is an amazing city with a lot of history, and we learned a lot. The most important part of this trip is that the LGBTQ plus community is really diverse. And even though we may not see these issues that are incredibly complex in everyday situations, they're still very much there. So it's our responsibility to look at the systems that we know, the people that we know, and continually question them, even here at LMU. So for this AB trip, we went to a couple different organizations, and the first that we went to was ACT UP, which is an AIDS and HIV activism organization that started in the 1980s in response to the epidemic. They've done amazing advocacy work and continue to fight for equality and healthcare access for everyone with HIV and AIDS. And what was the most incredible was that a lot of these people were there in the 80s fighting for equal rights. And the stories that they told us were amazing. And, they shared a lot of history with us and their plans to further fight for equal access. They actually have their 30th anniversary at the end of March.
Fight back, and gays!
Not an accident that it's only a block away because it's commemorating what happened in room 101 for most of the last 30 years.
And that's because we had St. Vincent's Hospital right here with an AIDS center in it, where a lot of us went for treatment at the time, and it has now been sold to a real estate developer who has torn down the hospital and put in luxury apartments, $20 to $40 million. But that is a hospital that cared for people with AIDS and other illnesses for 168 years.
After they were pushed.
Right. After we pushed them to do it. And those of you in public health recognize that, of course, we need luxury housing much more than we need a hospital in New York City. So thank God they got them there. Even for non-stigmatized diseases in people with resources, it's all of those things. So whenever you put a little stigma and a little, disability and a little poverty on the top of it, then it becomes life and death. And I firmly believe that, it is insulting to ask me to take my eye off the ball of our investment in our health. I believe that we pay taxes to develop these medicines and institute these agendas, and that the profit-making pharmaceutical company buys those rights and leaves nothing at the door for the people that created that investment. That's us. And they leave nothing at the door for the people who put their lives on the line to take the medicine experimentally. Once those subjects are done and the drug is approved, they have to turn around and buy that drug that they created with their own bodies. If that's not unfair, I don't know what is. Help to change the actual name of the sexually transmitted disease clinics in the City Department of Health to sexual health clinics in the Department of Health in New York City. Thereby sort of changing the sort of approach that the city takes to people's sexual health and targeting everyone that comes in for any sexual health visit as a potential person at risk who needs to follow-up care, primary care, follow-through care, testing.
So ACT UP taught us a lot about the intersectionalities in the LGBTQ plus community, and we learned a little bit about drug use within the community and housing and other comorbid difficulties that a lot of the LGBTQ plus community can experience. And so next we went to the Audre Lorde Project, which further solidified and reinforced this idea. What is the Audre Lorde Project about? What do they do?
Audre Lorde Project is basically an organization in New York that helps a lot of people in the LGBT community, especially those of color, basically helping them get rights and equality with legislation or acts or just stuff in that sense, and then also helping them find housing and be able to live and sustain on their own and kind of thrive in the city.
And so they need to be able to do some outreach, but the program's been around for about 20 years, so the outreach part isn't too hard. But they did say that their main way of recruiting people is by going to parties and being able to find people who would be interested in their programs and things like that. They also are willing to just knock door to door until they find people that need the services that they hand out. And so they're able to help build a nice community of people who really would like to use their services.
And then they also work a lot with anti-violence in New York with LGBT folks of color, and they do a lot of their recruiting through people in the community. A lot of people who live in these areas, they try to recruit them to the org, so it's not a strange face when who's knocking on their door and trying to help them. It's someone that they know in their neighborhood who they've worked with before.
For the whole trip, we stayed with Project Hospitality, which is a direct action organization that provides endless resources for the homeless population in Staten Island. So, working with this organization was especially powerful because we saw directly the impacts that LGBTQ plus communities can experience. We worked in the food pantry. We served food, we kind of organized some stuff and gave them a helping hand. And we also stayed in their facilities throughout the week. So we got pretty close to the staff involved in the community. We also attended an HIV positive dinner in which clients who are involved with Project Hospitality will come and eat if they have HIV, and um, it was a nice way to get to know everyone that we were working with and seeing on a day-to-day basis. We also spent a lot of time at the Pride Center of Staten Island and just kind of hung out with the staff there, did some cultural competency training, which was incredible, and just had some fun. We met a lot of the people in the youth group and did some art with them, kind of did like an exercise course with them, and it was a really good time. With our current political climate, there are a lot of complexities that go into this topic. And we saw that throughout every single organization that we worked with. ACT UP specifically kind of had to revitalize when Trump took office. And we have to keep looking towards the future and keep fighting against these disparities, these healthcare disparities, and social disparities as well. We even saw protests along the streets of New York of just people organizing together to make sure that they are being heard. And this is going to probably be something